What should,
Well, so I was hoping you would take a definitive stance on the cold plunge once and for all.
I mean, do you actually want me to take a definitive?
Yeah, go for it.
All right. Well, what are you putting something forward, or you want me to just?
Well, look, my stance on I like doing the cold plunge. I do it. My routine is 2 out of 3 days essentially. And I think there's some drawbacks to doing it too much. And I don't think there's anything uniquely special. Well, I shouldn't say don't think, but I'm not positive there's anything uniquely special about the cold. But I think that physiologically there's benefits from doing the cold plunge, maybe simply because it's doing something difficult, mentally difficult. And that alone might be enough to bring about these physiological responses, such as increases in dopamine, which is kind of like the motivation drug, uh, for lack of a better term, and it gets you excited to go do stuff. So there's also the resilience factor we've talked about before, where I feel like if I can set out to do something that I truly don't want to do when I'm waking up in the morning, it's not pleasant, but I go out and get it done, then it sets the tone for the day where even if I'm feeling discomfort, I'm uncomfortable in some other area of life or some other time during the day, I know I can push through that. That's about as strong as a stance as I'm going to take.
Yeah, I'm not completely anti-cold, but I'm definitely more anti-cold plunge being this sort of panacea for a bunch of stuff and like make these huge things. As far as I can tell from the evidence, it's like you're going to get better adaptations in almost every area from doing other things. Like going in the cold is not going to grow muscle or get you as strong as lifting weights. To me, there's much more evidence that heat has, extreme high temperatures, hot tub, sauna, that stuff has much better effect on like the heat shock proteins and cardiovascular adaptations that sort of mimic cardio exercise. And I just think there's kind of a little bit been an uh, overblown, obsession by some people with the cold plunge being, and a lot of the times it reverts to what you just said about doing something difficult. And I would argue that there's a lot of difficult things to do that do give you adaptations and payoff. And not that the cold plunge necessarily gives you zero, but if you're saying that, well, okay, I'm not sure exactly what adaptations physiologically it gives me, but it makes me mentally stronger. I would just argue there's things to do, such as like lifting weights or doing a cardio. It's like, who wants to get up at 5 or 6 in the morning and do like a hard workout? I mean, some people do, but some people now want to like look forward to the cold plunge too. And I just think that combined with the fact that it's pretty clear that probably it's at the very least it's not helping certain adaptations from actual exercise such as hypertrophy if you do it too close after, that just kind of leads me to be like, yeah, cold plunge is fine if you want to do it, maybe. I think if you were like a bodybuilder, you might want to stay away from it, try to maximize hypertrophy. It might not be worth some of the other things, but I could kind of take it or leave it personally. I would much rather do a heat therapy, sauna, hot tub, steam.
Yeah, so I think that part of why it's so popular is, well, one, it's kind of cooler to film and talk about because it's like extreme discomfort. It's almost like a novelty to try it. And it's also just easier to get it done in 2 to 3 minutes, right? Compared to a full lift, which is kind of taking the shortcut, but it's also something to consider. I think that if you're talking about getting something done, no, the cold plunge is not going to replace lifting or working out of any kind. But if you're talking about getting something that gives you that quick burst of fuel, mental fuel, to get some resiliency, build some resiliency, and it only takes 2 to 3 minutes in the morning, I think that's something that people can look at as a convenient way to get that you can't get from just work, or you can't get it from working out that quickly. But yeah, I agree. It's never going to replace working out. And I also agree because I do get people who ask me, I have a cold plunge and I do it frequently. And people ask me, like, should I get that? And I tell them, like, if I were to get one thing, I'd probably get the sauna, because you get a lot of the same benefits, but you also get a lot of additional benefits based on what the studies say. So bang for buck. I mean, certainly number one on my list of everything we've talked about is working out. Secondly would be the heat, and then third would be the plunge, the cold.
Yeah, I agree with that.
So then the other thing that I would say, that there's been some studies that the cold negatively impacts hypertrophy right after the lift, and there's been other studies that look at taking anti-inflammatories right after the lift is also it blunts the hypertrophy response. And so I think that that's pretty obvious. You don't want to do that right after your lift if your goal is to grow muscle. But I don't think that there's a lot of reason at this time, at least, to think that doing it well before your workout, is going to impact your hypertrophy, as long as you're not doing it like way too much or too long. And so that, at least that's the stance that I've taken with it. I do it 2 out of 3 days, like I said, for 2 minutes, in the morning. So I'll do it before my cardio day. I'll do it 2 minutes, and then before my first lifting day of this 3 days before my upper body day, I'll do that. So I get two in while I'm not lifting, and then I lift that afternoon. I don't do it the next morning. I lift again that afternoon. I don't do it that afternoon. So I get a full 48 hours basically off between cold plunges.